It's really, really important to continue to encourage people to participate in sport, and the fear of injury in sport is one of the things that is identified as a block to participation. The media attention to brain injury and concussion is a very real and ongoing thing, and I very much appreciate some of the expert comments we've had that would suggest that perhaps it's not always as severe as it turns out to be in American football. Certainly, the resource block here is a good background and a good basis, but as you'll have found from the reading of the material, the decision to return to play is now being handed over to medical assessment. Now, ideally, I suppose that's a neurologist or a sports physician, but in the real world, it may well be that you've attended a casualty department and you've been referred back to your family doctor. And as someone who works in all these areas, including family medicine, I might just sort of take you through some of the things that might be going on in the mind of the family doctor in response to these kinds of questions that have been asked by parents who are anxious about their children. And so again, any suspected concussed player must not be allowed to return to play before having a medical clearance. You've seen some examples where that medical clearance seems to be somewhat spurious, and I think most of us would have not allowed some of those players in those recent clips by Gary to have returned to the field. I guess that's the old school thinking, and unfortunately I've been around long enough to have been through the old school. However, from my perspective, I think it's very important to emphasise the difference. In elite sport, there's always going to be a pressure to get the players back. Some of that pressure is from the coaches, some of it's from the players themselves. In junior sport, in non-elite sport, the priority is the health and well-being of the player. It should be so in elite sport, but there are sometimes compromises. In junior sport, we've got to look after the sport, we've got to look after the kids, and there's no hurry to get people back. So how do we assess this? The initial assessment, I think we've been through that. As it says, number 1 and number 2, we can go to sports training courses, we can come to places like this, we can use the resources, we have a high index of suspicion. Often the symptoms are rather vague. The medical assessment, that needs to be done as soon as possible, and I see people in the casualty department who have been brought in by ambulance, and we've got to assess, where do they go? Do they go CT here? Do they be observed for a period of time? They're certainly not told they can go back to play the next day. They're told to seek further medical advice. There's a large variation from person to person. Now, I've been knocked out a lot. Some of them I can't remember too well, others I can. I'm not really sure if I've ever been really badly concussed. So I've been knocked out quite a bit. Have I had very bad concussion symptoms? Not sure. Obviously, you can't assess it yourself. I didn't have anyone telling me at the time, but to tell me I was knocked out though. Those are the bad old days when you return to play. But let's emphasise this. Most cases of concussion are minor. Most people recover within 10 to 14 days, and at that time, examination won't reveal any long-term problems. In the context of sport, what that really means is you're going to miss 1 game, possibly 2. If there's any doubt, you miss 2 games, then we're getting up to the old idea of having 3 weeks off, which may not have been such bad advice. Can you figure out whether a concussion is going to be bad or not? And there are some modifying factors. Now, these modifying factors remain controversial. I wouldn't hang my head on those. I think the most important thing is a medical assessment. Obviously, repetitive concussions or multiple concussions, all of these things will be things that would make you err on the side of caution. when you're making an assessment and recommending that someone returns to play. There hasn't been much talk about the so-called second impact syndrome, but it does seem to make sense that it would be unwise to risk a second injury before you're fully recovered from the first injury. This is something else that hasn't been spoken about much, but obviously different sports have different risks of concussion, and so that may alter your management depending on what kind of sport you're returning the person to. So if in doubt, and you're returning into a sport with a higher incidence, such as rugby union football or Australian rules football, again, err on the side of caution. My way of looking at the severity of concussion is it's severe if it's lasting a long time. So that means you can't tell it's severe at the beginning, because you could have quite severe symptoms, but they may only last a day or two, and you might return quite quickly to being normal. So even though that might have looked like a severe concussion, in actual fact it turned out to be not so bad. Whereas vague symptoms such as fatigue and nausea and not feeling quite right, but persisting for 2 or 3 weeks or longer, are an indication of a very severe concussion. Symptoms of depression and other psychological problems. Obviously, we have a lot of comorbidity. Medications have been mentioned as well. Things like severe brain swelling are probably more going to be dealt with more early on in the emergency department, but certainly, again, symptoms that are deteriorating, a condition that's deteriorating needs reassessment. Medical assessment will involve the differentiation between more significant head trauma and concussion symptoms. We did mention some of these modifying factors, such as length of amnesia, length of unconsciousness, but they're not always reliable predictors of the severity of a concussion. Just once again to emphasise, you can have quite a severe concussion without having a head injury that's so significant that it causes unconsciousness. Some of the worst concussions I've seen have been with a sort of semi-innocuous elbow to the side of the head, and then you just notice a player kind of wandering around aimlessly on the field. You know, no one would have recognised that impact, and yet there they are, not participating in play. That they need to be urgently assessed. The concept of a period of cognitive and physical rest that's been alluded to by previous presenters. I look at this in a similar fashion to rehab from an injury. So if you have a dodgy knee, obviously you go through a graded program of increased force on that knee, supervised by the physiotherapist. What concussion does is create problems with people's balance and coordination, and so once again, baseline testing will establish whether there's an impairment, but if you put a load on those people, then that impairment might reveal itself. So there might not be so much impairment at rest, but if you exercise for 5 minutes, then an impairment might become obvious. So a graded program is important. Similarly with mental function, function might be reasonably good in the morning, but by halfway through the day, headaches and nausea and lack of concentration return, indicating really that although there's a recovery in the process, it's not complete yet. Neuropsychological tests are going to be very helpful to the hard-working GP. So I've got 2 messages here. One is to all the trainers and parents, and that's to bring in the neuropsychological test, the SCAT3, which you conveniently downloaded yourself from the internet, and maybe do a little bit of preliminary filling in of that before you pop in to see the GP. He'll G will very much appreciate the fact that you've brought this tool along. In practice, despite Zurich 2012, I am yet to see anyone attend my surgery with a SCAT 3 or any other formal assessment at the time of injury. As sports physicians may have a different experience, but in general practice, certainly we're not seeing these things pop up. They're also not yet embedded in our software on our desktops, but they are very easy to download. For the GPs out there, Australian Family Physician, the latest issue has a lovely article, mostly by Michael, which is a little bit simpler perhaps in the consensus statement and easier for us GPs to understand. And again, the SCAT 3s are easily downloadable. Don't even bother, just type in SCAT 3 and Google will find it for you and you can download it. One of the advantages a GP may have is having known that patient for a long time, and that's the same advantage that the team doctors have. They know their players, and hopefully we know our kids, and we know when they're not quite right. We don't want them returning to sport if they're not quite right. We don't want the risk of a second injury, and that second injury may not necessarily be a concussion. It might be an ACL rupture because the balance and the assessment and the skills are not there, and they may have a completely different injury because you've returned them to sport too quickly. You should probably be all familiar now with the varying questions on cognitive function and also the balance tests. These are reproducible and relatively easy to do. Again, the average GP is probably not all that familiar with some of those tests. Our tests tend to be more in the area of dementia and Alzheimer's and cognitive function in elderly people, and usually we hand those over to the practice nurse to do. For the GPs out there, possibly training the practice nurses in some of these assessments may be very useful to facilitate the prompt management in the office. So you have to have a period of rest. I'd agree that no TV is rather impractical, especially for my kids. Also, if you read the symptoms, you sort of think, gee, that sounds a bit like my teenager. Forgets things. Yeah, he did. He forgot his sports shoes 2 weeks ago after his rugby game, and a week later he forgot his rugby boots. So, was he concussed? I don't think so. He acts like that most of the time. So you have to know your baselines, and that's where the parents, the teachers can be very helpful. Cognitive tests for school-age kids really revolve around being able to do their homework and being able to go to school and participate without getting headaches. And I say to them that you just take it easy, and then you can go and get through a whole day of school and a whole afternoon of homework where they might be on the right track. Other points in this slide are being covered, so I'll move on. Most will get better within 7 to 10 days, but we're more careful with children and adolescents. The brain is evolving. They've got to do this gradual return to school, sometimes a couple of days off and returning midweek. That allows a lesser workload. Medical clearance. Hopefully this hasn't hurt the medico-legal things so much that the GPs are not going to give you anything except a referral to a neurologist or a sports physician. But to my mind, it's a decision that's made between the family and the doctor and the patient with lots of advice and education. My take-home message for everyone here is education. Let's get these forms used. Let's get the awareness in the club level. Let's see kids being assessed properly, not allowed to return to play, and being followed up medically. You've got those documents, SCAT 3 and SCAT. The SCAT for children is for under 13-year-olds. I doubt very much where most children are getting a medical clearance before going back to school. I haven't seen that, but it's a good idea. Hopefully they're getting the concept of a medical clearance before returning to play. One tool that GPs use a lot in cognitive function is something we call the serial sevens. It's a simple test where you take 100, take off 7, you end up with 93, you take it off again, you end up with 86. I tend to use that test quite a bit on my high school kids. I throw a few times table questions at them. Again, you need the parent there as well to really get an assessment of, is this kid just a bit slow anyway, or is he way off his game? And I can tell you a lot of them are way off their game, and no one's really picked that up. They're coming to me saying, yeah, can you just sign this, and I just need to go back next week. And I say, well, hang on, let's just do some math. How are you going with that? And not only are they really slow, but then they look really confused, because it's the first time they've really realised that there is actually something wrong with them that explains why they're not feeling very good at all those things they didn't really want to tell the parents about the nausea and the headaches and the not sleeping so good.
Peter, can I ask you to leave it there?
Sure.
And we can just talk about the rest of it at our
Sorry,
panel.
I haven't timed that very well.
Thank you.
Thank you very much.